know maybe not everyone knows who I am, but my name is Matt Rahn. I am with ONC. I'm in the Office of Technology. I'm the Deputy Director of the Standards Division. I have been, for the past few years, and partly still in this role, I've been the Tools and Testing Branch Chief in the Certification and Testing Division. I will let, we're going to talk a little bit about the Cures update, kind of going over some of the things we talked about in July, and then Al's going to talk through the updates on USCDI and SVAP and some timelines, deadlines coming up, and kind of leave it open for people to ask questions. And I'll say we may not have the answer on the call, but definitely can follow up and find the answers for some of the questions you may have. I'll let Al introduce himself.
Yeah, thanks, Matt. Al Taylor, I'm a medical informatics officer in the Office of Technology at ONC. Amongst other things, I'm the technical lead for USCDI and the USCDI submission system, the new data element submission system. And I'll be talking about USCDI and SVAP, as Matt said. Okay.
And I'm very aware that this picture was taken like 7 years ago.
Isn't that you're talking about you or me? I think that's your high school.
Maybe both of us, but one of these days when we're back in the office, maybe we'll get a new one with it. Maybe the flag will be positioned on the other side of our heads.
I'm feeling much better now than when I took that picture. So
I was just wondering because Matt's got the stars beside his head, and Al, you have the stripe. So is it just relative height, or
it just kind of worked out perfect?
These were taken obviously at different times. Just how they said, I don't know. It's kind of funny. Like everyone I show this, they kind of laugh if they're not like work related. Like my friends, I've seen it. They make fun of me. Okay, so can you go to the next slide, please?
Yep.
All right. So anything pertaining to the rule on here, I just kind of give a disclaimer that the rule is what you need to go by. Sometimes I may say something, or people may say something that isn't actually what's in the rule. So I'm just saying that now that please refer to the Cures Act final rule for the specifics to confirm anything that I've said. But 99.99% of the time, what I say is correct. So as this. Okay, next slide. So if you're interested, I put all the Cures Act final rule links on here. A link directly to a bunch of materials that we have, webinars, fact sheets. On the first bullet, the second bullet is the USCDI. The third bullet is the actual Federal Register final rule. And then the fourth bullet is the 2015 edition Cures Update test method, where you can find the test procedures, to our tooling, and our certification guides. Next slide, please. And I kind of already went through this before, but just kind of for people that may not have been on the call, in the 2015 edition Cures Update, we updated and revised and removed certain criteria. The ones you see on the screen are ones that in the first bullet are ones that we've updated. And I'll get into a little more detail about those later. And then the second bullet is privacy and security framework updates that we made that the D2, D3, and D10 we've updated. The D12 and D13 are new. And you can go to our test method to get the actual names of those criterion. We've updated the B7, B8 data segmentation for privacy to be called the security tags, summary of care, send and receive. We've aligned the clinical quality measure requirement, C3 report for align that with CMS. And the B3, we've updated the requirement for a newer version of the NCPDP standard. Next slide, please. So as it pertains to this group, which will be mostly, will be what I cover on this slide, is the criterion that were affected with updates from the Common Clinical Data Set to the USCDI and or addition of the companion guide updates. So any sort of health IT module, any health IT module that's currently certified to the 2015 edition will attest, you only have to attest to the following criterion below, B1, B2, E1, G6, and G9. I have a disclaimer about F5 in a second. So you would need, all you'd have to do is attest that you've met the requirements. In order, if you were coming new to the program, you would have to obviously implement all the requirements and go back, please. And work with your ATL and then sort of get the stamp from the ACB. For F5, there is an error in the regulation that we are addressing via a certification companion guide clarification that right now it says that C-CDA companion guide needs to be, and C-CDA need to be adopted in order to meet that requirement. That is not the case. All that needs to be updated for that criterion is the USCDI. So right now there is a subset of CCDS, Common Clinical Data Set elements that are required, and we're just updating them to that to be USCDI related.
Can we ask questions as you go into this?
Yeah, please go ahead.
So the F5, the one for case reporting,
Yeah.
there's a implementation guide, EICR 2.0.
Mm-hmm.
Is that not the one that's in the rule? It says,
Yeah.
Is that the one you're talking about?
Yeah, it's so right now I'm just telling you that we just found this out within the last 24 to 48 hours, and it's something that we're addressing immediately. And ATLs, ACBs know about it, but there is no standard that we have applied for this F5 to meet this F5 requirement. We accidentally added C-CDA and the companion guide as a standard. We did not intend to do that. So that you'll see some updated language in the certification companion guide that won't be part of the requirements to meet that specific criterion. Does that?
Do you know what the updated language is?
I mean, you just don't have to. I mean, there was no change other than updating USCDI is what it will essentially say. Does that answer your question?
Yeah, because I posted a question on the ONC site about this implementation guide a while ago. There is the 2.0, the EICR 2.0 that is currently out there.
Yeah.
It does conform to C-CDA 2.1,
Mm-hmm.
the router version, plus and it has additional template.
Yeah. So, well, like what you're asking is great, and it leads into like later on in our conversation about the SVAP requirements and submitting standards that should be required in the program and that we may adopt in SVAP. So that's something that I would, if you haven't, Emma, maybe request during the open comment period, which is right now, to make that be a requirement for F5 if that's what you're looking at. Is that helpful?
Yeah, sort of. Yes.
Right.
Thank you.
Sort of. I want you to say yeah. So.
Yes.
So just right now, there's no standard. So there's no standard for F5.
There's no standard called out. Well, 1.1 was called out.
So, give me 1 second, and I will.
And since then, public health
exactly
put out
what it says. So as far as a content exchange standard, a specific one for electronic case reporting is not required to meet the criterion. And we say that in the CCG.
Okay.
Okay, and then whatever I don't address, if you have questions after, or as Al goes, please do ask. We can also have that be part of the end Ask ONC. For B9, you just attest directly to the ACB that you've made updates with the templates in the C-CDA companion guide that apply. So next slide, please. So this is the leading into what Al's going to start talking about, the United States Core Data for Interoperability. Obviously, these dates aren't up to date. You have a 3-month grace period right now, given the COVID requirements. So I'm blanking on the actual date, but I think it's August 2022 to meet this requirement to update from the Common Clinical Data Sets USCDI. We've added new data elements for provenance, clinical notes, pediatric vital signs, the address, email, and phone number. So health IT developers would need to update their certified health IT by the deadline in order to meet the requirements of the 2015 edition Cures update. And so Al's going to kind of go into the standard, the USCDI standard annual update, which we're currently accepting data element, data class submissions until Friday. But I'm going to turn it now over to Al, and then in the Ask ONC, if there's any like certification questions, we can address those. So if you can go to the next slide.
All right, thanks, Matt. This version of this look of USCDI is a little bit different than maybe some of the views that other people have had. This is a snapshot of the actual USCDI homepage, and the way that it is broken down. It's similar to the slide that we've seen earlier today on USCDI, but USCDI is currently comprised of about 15 data classes with individual data elements, some more than other data classes. And within each of these data elements has, in some cases, has an applicable standard which means that a system must be able to capture and exchange data according to that particular applicable standard. And this is not always the case. There's not in not all cases is there a required standard to represent each of these components. But in the cases where there are, they're listed, and you can find out what those are. There's 2 ways of finding out what those applicable standards are. One is by drilling down into this interactive web page to the individual data element level, and each page has information on some information on the data element, including its applicable standards, if there is one. The other way to find out what those applicable standards are is to look at the USCDI document itself, the standard document itself. I think most people know we published an errata for the USCDI in, I think it was June or July, Matt. But what it did is similar to the errata that Matt was talking about, where we listed an applicable standard for certain data elements. We recognized that was in some cases an error, and we published this errata to correct that problem. The requirements to represent and exchange the data elements, the individual data elements, differs by exchange standards, including C-CDA and FHIR. And so we, in some of these cases, we sort of allowed that standard or that requirement to stand on its own, as opposed to presenting sometimes conflicting required standards for USCDI when it differed from C-CDA and for FHIR US Core. This is only a few. This is only 6 of the data classes. The other feature of the website is the different tabs. As the new submissions come in over the next couple of days, they've been going on for the last few months. Where ONC is taking a look at the submissions and doing an evaluation based on some specific criteria that we have published. And we have determined, we make a determination as to whether or not these are what we call level 1 level comment, which is the comment is the first level, level 1 and level 2. And what we mean by those levels is the degree of maturity of the standard, the extent of use within systems, and the ability to exchange those data elements between systems, organizations. And so level 2 being the most sort of most mature, most ready, most feasible, and then going down from there. Next slide, please. The OnDeck system is the system we have in place to collect these submissions for new data elements. Anyone can submit them as long as you have an account on our Interoperability Standards Advisory or USCDI page. And you, like Matt said, that the deadline for submissions is midnight this Friday. So everything that comes in before then will be considered, will be evaluated for their level of readiness. And then once we've made a determination about which of these data elements that come in are designated as level 2, ONC will work on drafting the next version of USCDI based on those level 2 items and based on the criteria that that we've laid out. To help with submissions, if you have mind to do submissions or you've got submissions underway already, I don't have the screen, but in step 1, the USCDI OnDeck submission form prep sheet has a list of all of the questions that are required for submissions, as well as some sort of helping language, or some of the criteria, or some examples of what would consist of an adequate response to achieve a certain level within USCDI. And that's downloaded. You can download that just by clicking on the link. This is actually not an updated page. Our current page is a lot easier to find the prep sheet, but it's within step 1. The link on this page is in the second sentence. But if you go to the OnDeck homepage or landing page, there's a big button that says take a look at the prep sheet, and you can use that as a guide to prepare your submission. Once we've submitted, like I said, once we've submitted all these data, once we've evaluated these data elements, we're going to look at the ones that are designated as level 2 and draft our version 2 of USCDI, which we will publish for public comment around the 1st of January. And then after about a 4-month period of public comment, feedback, and rework, we will come out with our final version of version 2 of USCDI around July of next year. Once that becomes a final version 2, the national coordinator will make a determination as to whether or not that new standard version 2 can be integrated into health IT through the standards version advancement process. It's one of the standards that Matt was talking about, including, and that includes C-CDA 2.1 or updates to that in the future as to whether or not those standards can be implemented into health IT prior to a new ONC regulation. The next slide, please.
I have a question now.
Yep.
So how, I've been involved in a couple submissions. How, are you guys waiting until all of the submissions come in before you evaluate and assign before step 2?
No, we're doing it on the fly. We're doing it on the fly, but we also, we've been working on making the evaluation criteria more objective, more concrete. So, and because the bulk of the submissions have come in the last week or so, we have to handle them as they come in. So we're not waiting until the end, but as we're just ramping up our evaluation and in response to the increased demand.
Yeah, and you can see on the website now that I know these are just slides, but if you go back one slide, please, John. So right now, if you clicked on level 2 on the website, like it'll show some data elements there that have been put in that space, and then level 1, and then comment.
Yeah, and this is it would be almost would be the number of new data classes, data elements that have been submitted up until currently is significantly more than what's on this slide. We currently have about 10 new data classes, 10, actually closer to 20 new submitted data classes, along with about 200 data elements. And we're in the process of evaluating each one of them, see which ones can be merged into other ones, see which ones are already represented by other existing data classes and data elements. So don't, when you hear numbers like that, don't think that it's not necessarily, we're not necessarily going to triple the number of data elements required for USCDI in the next version. We're looking for, a modest change to it, but we're responding to what the submitters are asking for.
Al and Matt, this is John Demore, and Al, thank you for the comment earlier in the chat too. I had a slightly outdated version, as you mentioned, and this is obviously a representative source for it. Author's not in the provenance, so it's just the organization and the timestamp from the provenance perspective. One question I have just about the process is for the ODEC or OnDeck, I don't know exactly how to say it. If you want to provide support for something that's already listed in level 1 or level 2, is it better to submit a new OnDeck, or do you just want us to comment in regards to that individual resource?
I would say that with existing data elements, and this is a built-in functionality, is the comment process. For something that is that's already in there, that's already published, I would suggest that you add a comment. In the comment, what we're looking for in comments is not just, I say not just, but it's not, we agree with this or we support this. The information that would be helpful to us to make a determination of maybe a higher level, especially for the ones that are level 1 and comment, but even for some level 2s, which have sort of modest implementation, modest exchange, we're looking for comments that are substantive and additive to the value, feasibility, readiness of the data element that's been submitted and given that level, if that makes sense. So some people may put in a submission that they're not aware of some other work group, some other function, some other activity or organization doing implementation on that particular or related item. So if other people know about them, you can either give them a heads up to go in and comment on it, which is a really good way to do it. If you can't coordinate the input and the content of the submission before you submit. That said, if you want to just submit your own, we'll take it. And if you submit, if we find 2 submissions, and there are some cases of this already, where 2 submissions have the same data element or the same data class, we'll look at them and decide if these are unique or they're just different use cases for the same data element. And we'll merge them. And we'll merge the use cases description so that everybody can see, all of the different use cases and all the different values that it provides. So any of these.
No, that's very helpful. I'll try to get in some comments before Friday.
Yeah, no, obviously the intent would be to adopt in future versions data elements that are, that have been tested and are being captured, by, more just widely adopted and not just us throwing something in there in general.
Yeah, and
Al?
in some examples, go ahead.
Oh, this is Lisa Nelson. The process that you have, I salute you for reaching out to the whole community and taking on a massive submission like this and a commitment to do it on an annual basis. It's awesome. Have you thought about, or have you run into anybody challenging or coming up with alternate ideas about how to organize the data elements within the data classes? I myself am working on a submission that is not in yet, so you haven't seen it yet. But as I was doing it, it was difficult not to push towards a multi-axial sort of hierarchy, where some data elements may actually belong in more than one data class.
Yeah.
And as you get more data classes, I think we're going to start running into some of these issues. Have you thought about needing to be multi-axial?
Yeah, we have. And yes, we've seen some of that already. I can give you one example that I think belongs in more than one category, or more than one data class rather. And that was a recent submission for under problems for problem onset and resolution date, as well as diagnosis, date of diagnosis. Those are concepts that can be applied directly to problems, but onset and resolution, or begin date and end date in another parlance, that function could be used across more than one data class. So we do recognize that, and so, but right as it stands right now, we don't have there are no data elements currently in USCDI that talk about start date and stop date. And so if we have something that is listed as a data element of problems that is equivalent to start and stop date, that could be used for other things. Things that come to mind that it can be immediately used for is address. So not saying that you have to say a start and end date for address, but that would be one way to convey prior address or current address, for example. And there's a lot of other examples, and knowing them, because some of these, especially with that concept is present, that modular concept of beginning and end date is present both in C-CDA and FHIR. It looks a little bit different across the different standards, but that sort of thing could be. I don't know if we copy paste that from data class to data class to data class, if that's, if it does apply to more than one data class. We've thought about it. I'm not sure that we have the right solution yet.
Yeah, I mean, that's something that we could probably just clarify in a CCG in certain cases, but in the interest of time, Lisa, we'll move forward, because I think Al has a few slides that we need to get through, and then do we have a 15-minute break after this?
Yep.
Yeah, all right. So I am signing Al and I up to stay longer for that 15-minute break if people want to, but also if we don't get through a lot of things, happy to join a structured docs call to present. Okay, go ahead, Al.
All right, so this is just an early example of a submission, and it's based on the level 2. We have some general guidelines about what the level 2 criteria are. But as Matt had said, we're looking, a level 2 data element is something that has already demonstrated some, not only good standardization, but also has already demonstrated a significant amount of standardized use and exchange across organizations and systems. In addition to that sort of data maturity aspect, we're looking for, like, what is the implementation burden? So things that are already part of certification has a relatively low implementation burden, just as an example. Next slide. This is just some additional information that you get to look at the public can review these. This is one of them from the facility level data, and you can take a look at that and click on the links and the downloads for the components of that submission. Next slide. This is the timeline that we've talked about, and we're in near the end of the submission and review period, the very end, after which we'll create the draft and publish that draft for public comment. The key part to this slide that I want to cover, and this segues into the next slide, is is once we have finalized the version 2, that new version of the standard will be considered for a voluntary addition to for developers to implement that update into their system. It would not be required. It would be voluntary. It could be voluntary in response to a particular customer request, but it could be that request could be more in the form of a demand or an order for that update, but it would be voluntary for systems to be able to use that new USCDI version. And then they would be able to claim that without going through the whole recertification process. They could say we have a system that's updated to USCDI version 2, or within the example of other standards that are finalized between now and now in the cutoff period for this year. It's just in a couple weeks. Standards that are updated prior to that cutoff could be considered for voluntarily updating systems. But again, it is not a requirement if it's an updated version of an existing standard. That's not that we are not writing into a new rule. It would still be a voluntary update.
Al, I know you guys are trying to go quick, so feel free to give this a short answer, and we could talk about it more. But just in the way that you described voluntarily adopting and attesting to support of, for example, USCDI version 2 or USCDI version 3, it seems too not granular enough. As the pool of data classes and data elements continues to expand, I could definitely foresee that there would be systems that would want to implement some of the version 3, but some of the USCDI version 3, if you're getting at some level of very minutia cancer stuff or very discrete lab things where a system might not need to have that granularity of data, but they might want to say that they support 10 other V3 data elements. How can we get more granular than just the all or nothing? So,
in short, that won't be a thing. You'll have to do all of the version 2 or the version 3. There's no partial certification in that realm. But I think the goal is to make this. I don't foresee adding 100 data elements between version 1 and version 2. And even later on. I could be wrong, but I'm just saying, I don't think it'll be that extensive.
Okay.
Yeah.
And it might be that to do it might mean that you can consume it as opposed to that you can create it. So that would be another distinction, right?
Yeah, and this also pertains to all of the standards that would be SVAP. We will take into account backwards compatibility, but some point, if we don't have a rule for 10 years or something, we might have to go into a version of a standard that may not be backwards compatible. And, it's technically still optional, but, that's something that we'll need to assess.
Well, if you say that that's a great question, because I asked Steve that question. He said he felt like most things would be additional. It wouldn't be different. It would be, not interfering with backward compatible. But if you start, let's say everybody decides to go to, or whatever, the SVAP moves us to FIRE 5, for example. Thinking about that, does that mean that systems have to support both versions when you do make backward incompatible changes?
So our goal would I don't want to say we would never do that. We would never put a standard that's not backwards compatible, but it will definitely something that we think about before we would make that tough decision, right? I would say if you decide to move to R5, that is what your system must be capable of supporting when you go through real world testing, surveillance purposes as part of the program. But hopefully there's, at some point there might be, but if between, this gives an opportunity to move up to, like, if there's a new version of US Core 3.2 or whatever, 3.2.0, you know, that gives us an opportunity to put that into the program. And we know people want to update to that version, and that, you know, that's right now it's still on R4. So to try to answer your question is, I'm hoping that, I'll just let you know that we will not, like, it won't be like something we didn't think hard and long about if we were adopting a standard that was not backwards compatible. Does that help, Linda?
Yeah, if you have some on R4 and some on R5, they're not really interoperable, right?
Well, it should be though, well, shouldn't it?
Depends upon whether, remembering only some of the resources are normative right now, right?
Mm-hmm. Yeah, so I mean, that's a decision we'll have to make, but, you know, by the time maybe that we even get to R5, that could be 3
right.
years from now.
It certainly isn't going to happen next year type thing, but it's something to be thinking about.
And, you know, and that may be a reason why we go up to R5 immediately, you know, like, and then, you know, some things, there's a chance that would just wait until we put out a new rule, but, like, you know, for purposes of things like USCDI, the, like, CMS QRDA requirements, like, this process just makes it easier to make it part of the program, right? Those other things we'll have to look long and hard at whether or not we update to.
So just real quick,
just
you want to flip to just flip to the next slide. This is just we're currently accepting comments about the existing. This may not be the most update slide, a screenshot of this, but on the SVAP page that the link is listed here, are versions that are either about to update or recently updated that could be considered for adding that to the list of SVAP standards, which are, again, not required. The new version might not be required according to a previous rule, like our Cures Act rule, but it could provide some additional benefit to adopt it. So these are the ones that are listed, and you'll be able to add comments to, like, we think that version 1.2 of Direct ought to be added. So that's just, anybody can go in and comment, and the comment period is, Matt, help me out. It's within the next couple of weeks. I think it's
November 9th.
I think it's November 9th. Yeah.
Yeah. And I'll say one thing also is the ISA interoperability standards. Why am I blanking on?
Advisory.
Advisory, thanks. That also is under comment period till November 9th.
So in regards to information blocking and being tied to USCDI v1 at this point, will it be tied to USCDI v2 until all EHI is required?
Probably not, because it's voluntary. V2 will not be required. It's not required according to the rules, and the current definition of EHI is defined by USCDI v1. And so it's not likely that you're gonna have to step up to version 2 to conform to EHI export.
I do want to clarify though, if you decided to update to USCDI version 2, then yes, you would be held accountable to those requirements.
If it's in your EHR?
In real world testing and surveillance.
Okay, and then what about the API? Is it required to step up to V2?
No, so nothing is required to step up to V2.
Got it. It's all voluntary. Okay.
Yeah, it's all voluntary. And in SVAP as well. If there's this SVAP, we put out a list of standards. It's all voluntary. There's some things that, like, CMS may require that you have to do that technically make it not voluntary, so you have to do it anyway. But from our purposes of our program, it's, you know, if you update to a new version, whether it be USCDI or, you know, any other, like a new version of C-CDA or something that gets put into the SVAP, that's all voluntary. And, you know, when you decide to do that, that's when you are accountable for meeting those requirements going forward. So Al, I think
Okay, thank you.
Yeah, the other slide is just this next slide, and then we talked about this. The SVAP period will be annual in this same time frame, where we consider updates to versions, updates to standards over the previous year, and we're just wrapping up the comment period for that. Next slide.
Yeah, I think that's it.
The last one.
But yeah,
Okay.
I think the important thing here is for USCDI, October 23rd on Friday is the last day to provide input on. For SVAP and the ISA, it's November 9th to provide feedback on that. I know we're 2 minutes out, but I'm willing to stay till 2:45 till we start the new the next session.
Yes, sir.
People want to ask questions.
Yeah, clarification on USCDI V2 input. You just said the deadline's Friday, but that's the deadline to submit submissions, right?
Yeah,
What's the deadline for people to add their comments to the submissions?
Well, we don't have we don't have a fixed comment, because I think that some of these submissions, especially the ones that are coming in at the last minute, which are all of them now, they're going to take some time to process, and we may request additional information from the submitter. And then once those things go into place, once those are published at a certain level, other people can come in and comment on them. We don't have a fixed cutoff for comments, but at some point we have to, you know, we have to say, at some point we have to say, we're going to stop unless there's, you know, we're going to stop considering additional input. Because what happens after, what happens after we, once we have sort of finalize all of these level 2 data elements, we have to start deciding which of them are going to go into the draft version 2, which will start a new, once we draft and publish a draft version 2, that will start a new public comment process. So there is another opportunity to comment on things later, things that didn't make.
Yeah, Jeff, just to add on, like, this is the first time we're doing this, so we're kind of, you know, we may learn things as we go along with the process. Next year, we may build in a specific time frame for there to be comments. But, you know, if you do have comments, I would do them ASAP on specific elements that are in there. But yeah, as Al said, we don't have a specific time frame right now, but you will get a chance to comment on the USCDI version 2 at some point.
So the likelihood of like a specialty EHR system to have their data considered for USCDI V2, what does that look like? Like if you had a lot of oncology or ophthalmologists put in data elements, it's not going to be required for everyone because it's optional, but what's the likelihood of that being approved?
So you can see right now there's some ophthalmology. I don't know, Al, if you're going to go there, but right now there's some ophthalmology related.
Yeah, we put some in there.
They're in the
and so one of the, we recognize that, like, sometimes there's a specialty data element, and sometimes a specialty data element is really just a subset of some new concept, some new, you know, like a lot of these new specialty data elements could be observations, generally considered observations, or and in which case we might, instead of adding a specialty observation as a new data element or a new data class, what we could do is create a larger container of something like an observation, or a larger, something like a diagnosis, like an encounter diagnosis, which is a submission. We might sort of combine those into common ones that are more widely applicable. And then those requirements for specialty would be defined by something like a value set for a particular type of observation, for example.
Okay, that makes sense, thanks.
Hi, this is Denise Lee. I just have a question about attesting to version 1. are there instructions on how we attest to that?
Yeah, I mean, if you go to the test method, I put in the, I don't know if they've shared that yet, but basically, if you can attest directly to your ACB for those requirements as it pertains to the criterion that USCDI version 1 applies to.
Okay, thank you.
Yeah. And if you go to the test method on our website, I'll put the link in the chat. You can find more information. But for purposes of, if your Health AT module already has 2015 edition, you just have to attest directly to that.
Building on the theme of this being the first time this has happened and the expected kind of first iteration 0 noise, let's call it that. If someone submitted created or put a submission in several weeks ago, like 4 or 5 weeks ago, and hasn't heard anything, could that be because of the confusion when the submission includes multiple data elements? And if so, should we just resubmit something by itself, or?
No, it's not. I don't read anything into it other than it's the first time through confusion. We actually, like I said earlier, we were working on setting more concrete evaluation criteria, and we're working on those things. If there's and so we're gonna get through them. We're working on getting through them, but don't read anything into it other than we just kind of don't have our shit together just yet.
Yeah, no worries. So bottom line, don't add
That's
to the
downright
noise.
honest.
Yeah, and
mean,
what I
you're
should have
asking
said was I don't have my shit together yet, because I think that one came to me, but it could be someone else.
Right. So you don't want us to pile on.
Yeah, we're still working on going through all the ones that have been submitted. So yeah, if you don't see it, don't worry.
Well, Matt's not, but the rest of us are.
All right. Thanks. Guys.
Well, I'd be worried if Al didn't address it. But yeah, so I think next, as we're working through this, we'll have more clarity on how we can improve our system per se for the next go round. But know that we're getting a ton of submissions.
So Matt, are y'all ONC going to be around for the next section on encounter summaries or no?
Al, are you able to stay?
Let me just double check.
Yeah.
I mean, I just have a lead-in question that I've brought up a couple of times. I don't know if it's time yet, so I don't know if anybody else has questions. I don't want to jump in too soon here.
Well, go ahead. I mean, go ahead and ask.
Go for it, Rochelle. Go for it.
You dominate.
Okay, so this, I'm sorry, John, stop it. Okay, so in 2014 edition, I'm going to go back to this because I've sent emails and I really need an answer for our clients. But in 2014 edition, I have a lot of echoing, but E2 clinical summary was one of the measures for patient-provided data. That E2 clinical summary is encounter-based, and it is still being used in the wild out there. People that certified 2014, certified 2015, that's the document that the ambulatory environment is given to their patients. Now, this goes back to all our specialty clients that are what happened to the document? Why isn't ONC using this anymore? It's the document our patients want. It's the encounter document. now we're starting with this encounter conversation, and I know it's not part of ONC certification right now, but I do really feel like there needs to be a link from that past document into anything we do with encounter summaries, because it is being used and it is an encounter-based document. And when ONC tested it, it was very specific. We were also able to move sections around and hide sections, and that was the module that required that the C-CDA can be editable by the physician, and you can configure and change sections and hide sections. So I just want some clarity on that. What do we tell the implementers of that document? We don't offer it in our solution anymore because I mean, we can create it, but they're the ones that are using it and are transporting it and want us to take that into our system, as well as want us to make sure we consider it for encounter summaries. How do we handle that, and why was it dropped by ONC as not a certification criteria?
I'll have to do some digging, but 2014 edition obviously got removed completely, right?
Well, yeah, no, that's my point. It was removed, but we moved to 2015, and we seemed to focus on what the hospitals needed. And again, the ambulatory environment was, I feel like it was overlooked. And that, I mean, they don't have a strong enough voice to come to the table. They're just trying to get things done. But they are using these documents, and they do want to exchange these documents. And if we're going to bring a whole nother
template?
Yeah,
I don't even recognize
what are
the
you referring
document,
to?
Michelle. What is it? What type of document is it?
It's a CCD, but it's an encounter-based CCD. It's a CCD that only had one encounter in it. It didn't carry the patient's history. It was encounter level, not patient level. And I think I sent both of you, Lisa and Matt, I think in the past I've sent emails, but it's not going away for me. And Commonwealth kind of hasn't taken over in that EP environment or ambulatory environment at this point where they're using that implementation guide. But I do see lots of good things in that IG guide, and we did implement it, and I'm going to have our users use it, but it still hasn't.
Who wrote the IG for that? Who wrote the IG for an encounter-based CCD?
We used the CCD, and we just included information for one encounter, and the test tool tested it and validated the schematron. There was a specific test set for that. So ONC would have to give you more specifics on the schematron and what was being tested through that process. But it's very specific to ensure that you didn't have prior data in that document.
Yeah, I mean, I need to go back into the requirements there since it's been removed. We do have it archived, but I'll have to remember. I can't think off the top of my head, but I mean, a CCD is still required as part of our program. So in a sense, you could use a CCD to do that.
Okay, so I'm in the chat. I'm going to go ahead and put the actual approved document from 2014 edition, just so you have a reference link. But of course, the test tool and everything's removed, as well as the test data. But that is a good link to start with. And it's mentioned in the final rule. A clinical summary was named in the final rule for 2014 edition.
Okay, so you said you sent
I'll resend it.
Okay, all right.
You and Lisa are on an email, so I'll send it again,
Right.
no problem.
Resend it. Sorry.
Yeah, because it has everything you need in it. And I would leave it alone if I didn't have so many people that keep coming back to me. And as soon as I say the word encounter summary, I hear, what about the clinical summary? And it's a battle, my own battle, but it would be nice if I had more information about the thought process behind removing it completely.
Okay.
It's interesting, Rochelle, because I know that one of the submissions that's gone in from Regent Street addresses some change requests for straightening out the clinical notes data class. And I'll talk about this in my talk at the end of the day. You'll see it, but there is a request for some missing clinical note types, and that outpatient report is one of the missing types that they've identified. And I wonder, just to put things together, if maybe the thing that you're talking about and the LOINC submission Regent Street comments that are going in about clinical notes might align there, and maybe that's something to keep in mind as you look at the submission from Regent Street.
And we're going through like the clinical notes specifically with our clients that have this clinical summary. And it's just interesting that it just seems like it took a different turn and someone else had more, someone else besides ONC had more say-so in the way 2015 edition went. I mean, that's just what because I just don't know where it happened, but hopefully we can address it in clinical notes. I just
totally
don't
just
understand.
did it we did it totally just to be a thorn in your side, right?
I know y'all do things, y'all rename stuff and y'all do it just because of Rachelle. I understand. Please stop.
Rochelle, they called it outpatient note. So I think that's
Okay,
the one that you're
thank
looking
you.
for, and you could reinforce with a comment that outpatient note was something that you guys have a business requirement and definitely a use case for representing, and maybe that would give weight to it. Okay, perfect. Yeah, I'll look at that and we'll go back through it.
Comments on those data elements. Sorry to interrupt. I was just say that comments on those data elements, do carry weight. So.
Okay. Got it. Thanks, guys. Appreciate it for hearing me out.
Always. If we didn't get to something and people want to talk about, happy to, come to a structured docs call and answer anything else. Obviously, you can have more focused discussion at the next IAT if there's one. But thanks for.
Al, is there a time frame for when, do you have a hard deadline for when you think all of the submission comments will be processed and we'd be able to know that everything in the queue got through your adjudication process?
It would be kind of a wild guess on my part. What I'd like to see happen is at least we get the ones that, whether or not we get the level right exactly, I'd like to try and get them all at least published, the ones that we are going to publish at some level by. I'd like it to be the end of next week. I think that depending on how crazy it gets, it might not be possible to at least get them assigned a particular level to do the full evaluation might take longer than that. So I would say that 2 weeks at the most, but again, that's not a promise. But I think that, we owe it to everybody who submitted to get that stuff done.
Thank you.
So Al, are you going to be able to stay for a little bit? I got to step off for the next one, I think.
Yeah, I think I need to restart my computer though. But I'll be back on.
All right.
Yeah, I need to restart my computer. Something screwed up about it. So.
And thanks everybody. And I thought that I had slides with our contact information, but I will put it in the chat.
Thank you very much, Matt and Al. Well, and Al, welcome. We hope you'll